I decided to put together and invite two friends to talk a little bit about a different approach in cancer treatment. And I have with me Dr. Alex Delgado, a medical oncologist and cancer nutrition specialist. And I'm already claiming a cancer survivor, Mayie Tanglao. And the reason why I have these two beautiful souls together is Maye's oncologist is Doc Alex. And somehow there is a sentimental component here because when Doc Alex returned to the country, Mayie was his first patient, returning medical oncologist. And, Mayie went through something different, which I want to ask her. Okay, Mayie, my question to you is, the typical chemotherapy. Your doctor can either be there or not there, and the misconception of everyone is that doctor should be there. In your case, Dr. Alex was always there.
Yes, he was, yeah. All throughout the 8 sessions, he was.
All throughout the 8
Yes,
sessions.
yes.
Okay, so I think we're raising the bar a little bit because not all medical oncologists, and there's a reason for that, Doc, no? But, each has its own style of caring for patients. How has that helped you?
Actually, yung first chemo ko pa lang, parang sabi ko na nga sa mga friends ko na I felt bad for the others. Kasi wala silang kasamang oncologist. And for me that was my first session, and I had expectations because my friends who were cancer patients, nagsabi naman sila sa akin na kung ano yung pagdadaanan ko. So, in a way, nakatulong sila sa akin. But at that time, I didn't expect to be so emotional, di ba, Doc? In fact, sabi nung friend ko sa akin, alam mo, ikaw lang kakilala kong cancer patient na excited mag-chemo. And I said, bakit naman hindi ako ma-excite? Because chemo will heal me, di ba? It will make me feel better. It will get rid of my cancer cells. So, I'm so excited to start on my chemotherapy. And then, just a bit of a background, di ba? Before I started my chemo, may pinadala sa akin si Doc na para siyang audio file na you will have to listen to it and isipin mo na how chemo will help in your healing journey, ganyan. So, isa-psych mo yung sarili mo. So, pinakinggan ko siya. So, parang game na game talaga ako. Parang feeling ko, sige, tapusin na natin to 2 oras, ganyan-ganyan. So, he was with me, ganyan. Tapos, and then, we prayed, di ba? We prayed. Doon pa lang, medyo hindi pa nga ako, naluluha pa lang ako. And then, may pinakinggan ka sa akin ulit, Doc, di ba? Na ito sa repeat of what I heard the night before. And then, nung ini-inject na sa akin yung chemo drug, kasi sabi lang Red Devil, kasi color red siya. Oo. Doon ako nag-breakdown ako. Because everything was real at that time. So, talagang totoo. May cancer talaga ako. Kasi in a way, parang, because I wasn't feeling anything except na may bukol ako. Yun lang. Because hindi pa rin nga luckily, hindi siya nag-mesticize. So, hindi masama ang pakiramdam ko, hindi ko inuubo. I was not feeling anything.
But you being emotional at that particular moment was really an acceptance.
Yes.
That cancer indeed was in your body. But the beautiful thing was you were not alone.
Yes.
You had your doctor beside you. How comforting is that?
Very comforting. Una-una, di ba? He prayed with me. And parang feeling ko, and from experience din, most oncologist na kinukwento sa akin ng mga friends ko, para siyang yung
Transactional?
Yes, transactional. This is
Hindi magko-comment si Doc Alex doon. So, tayong dalawa na lang.
sige. Doc, kunyari, kami din, Doc lang. So, in fact, kaya rin ako napunta kay Doc Alex eh. Because yung first oncologist that I consulted with, parang, oh, itong case mo, ito. Ganun lang. Walang, tapos when I asked na, Doc, sa tingin nyo, kasi at that time na first consultation ako, wala pa akong result ng mga scans eh. So, I didn't know pa at that time ano talaga yung stage ko. So, sabi ko, Doc, anong chances kaya na kumalat na siya? Kasi wala naman akong nararamdaman. Eh, hindi natin malalaman yan hanggang very dismissive. Which was stark difference from how my consultation with Doc Alex went. Na in fact, magkausap kami, di ba, usually ang doktor, andito siya, tapos
Sits
may
across
table,
you. Yeah.
oo, tapos may explain. No, ganito kami ni Doc Alex. And he asked me how yung journey ko, paano ko nakapunta sa kanya. So, it was really comforting na from the time that we had consultation to my first chemo, nandun siya all throughout. In fact, di ba, Doc, he suggested na because my house was so far from Manila Med, he asked kung parang he was going to look for an infusion center near my house. So, parang yung travel would be easier for me. Ako naman, sabi ko, pero Doc, dahil nga ang ganda na experience ko sa kanya ng first chemo ko eh. Sabi ko, Doc, kung hindi lang ko lang kayo makakasama, dyan na ako, itsatsagain ko na yung Manila Med. Sabi niya, no. I will be there for you your entire healing journey. Hindi niya sinabi na he will be with me hanggang end ng chemo ko My entire healing journey. Diba? So it's so comforting.
That's so beautiful. I want to pick out something which is one of the reasons why I want to share this. It's a different approach. Doc, can you explain about what was the process that you asked her to go through? The meditation.
Right. Because remember, I came from a training of psychotherapy and counseling, and one of the modules I took was about hypnotherapy. Remember that whatever the patient's images are in her head, if he used the chemo as all the side effects and all that stuff. So I need to reframe that and say, look at your chemotherapy as your ally, not your enemy. So I went into some hypnotic suggestions on her through those audio files, telling her na this is your friend, this is your you will not vomit and all that stuff.
So really, it's how the mind
Correct.
looks at chemo.
Correct.
And you know, the reason why I'm so interested, because I went through something similar, only that I didn't have him before. When I was looking at my chemo as, oh my God, I'm gonna go through chemotherapy again, I'm gonna be infused with poison. My side effects was off the charts. I was vomiting, I was having diarrhea, it was really bad. But when I started looking at my chemotherapy days as healing days, I noticed the side effects were so much less. They were manageable. So, tell us, how were your side effects, especially on your first chemo session?
It was so manageable. I did not experience yung vomiting. Medyo may konting discomfort, like yung acid sa stomach. Pero other than that, okay ako. Okay ako kasi nga, yung meditation nga really helped eh. It was so yung you were looking forward. And it's not something you're looking for, it's not just you're looking forward to the end of the chemo. You're looking forward to a life after chemo.
That's great.
I remember imagining, kasi di ba, Doc, meron dun yung you're on a tree or on a special place, you na-imagine ko talaga yun, yung favorite spot namin. Sorry, naiyak na naman ako. Umpisa pa lang to. So, favorite spot namin ng family ko, whenever we have yung vacation sa beach. Andun ako, and I was not imagining na yung little boy ko, yung youngest ko, at this age hindi. Matanda na siya. Medyo ano na siya, teenager na siya. Ganon. Ganon siya nakatulong.
So you had a vivid picture
Yes.
of life beyond cancer.
Yes. Yes.
I think
yes.
that's so important for all cancer patients who are watching. That you really mentally
Yeah.
and I think spiritually prepare yourself and being grateful to chemotherapy and not looking at it as something bad.
Yeah.
It does a lot to the body. And I remember both Dr. Alex and I were texting Mayie, and all she told me was, I just have a slight headache.
Ayoko.
And then she texted me and I'm awake, I'm eating a lot. That's always the case for you. Like just a little bit of downtime.
Yeah.
And excuse me for the words, you will always say, Eto, Miss Cha, lumalamo na naman. Like her appetite would she could easily recover. So I think this is a practice that I hope people who are listening out there can do, which has helped you. And the reason why we're documenting this because I think it's really, really important. The whole meditation, the whole holding space for the patient and not just treating your patient like a transaction or a patient number. It's very, very important. I know Doc Alex we're making him so uncomfortable, but I think this is something that patients should aim for.
Yeah.
And very importantly, that vivid picture of what life without cancer looks like should be there because it's something that we look forward.
Yes.
So thank you so much to both of you and hope to see you soon.